Hello everyone and welcome back to another video, Sisterly Conversations. We will be continuing Shanita's endometriosis journey. So this is part 2. Um, so the question is, what were your surgeries and how many did you have?
So for my surgeries, I would say I had 4 surgeries in all. With the first surgery, as I have mentioned in part 1, being more so a procedure, but because of the fact that I was put asleep, I call it a surgery just because of um, that fact, along with the fact they had to go inside to check certain things. So I see it I just call it a surgery, but some people might call it a procedure. It wasn't a surgery per se, but 2, 3, and 4 were definitely surgeries. Um, with number 2 being a surgery to remove endometriosis from around my navel area, and the endometriosis was causing a hernia. It's called umbilical hernia, where it caused my inner navel, because I've always had an innie or inner, like people say innies. I've always had an inner navel, and it caused it to become an outer navel. And it caused a lot of excruciating pain around that area where I believe my navel was twisting. I don't even know if that's the correct term. Something was twisting because it felt like something was twisting, and it caused me so much pain. I had to rush the hospital. I didn't rush the hospital the first time. What would happen is it would cause me excruciating pain, and eventually the pain would stop, and so I'll be fine. But the last time the time I rushed the hospital, it was just continuous pain. It would not stop, and also my navel will end up going back in, but this time it just stayed out. So it was bad. So I ended up going to the hospital, and they ended up giving me an emergency surgery. At first, I think they tried to like push back in the navel or something, but it wouldn't go back in. So they had to give me this surgery to correct the hernia. And um, in the end, they also, I believe, removed some of the endometriosis around the area, but not all of the endometriosis was removed. The third surgery came about, um, I would say it was probably 2022, no, or 2023. I think it was, yeah, it was in the beginning of 2023. And I remember this because my surgery to remove all of the endometriosis was planned for August. But because I ended up having this emergency surgery, I think it was in April or May or something around that timing. Um, it ended up getting pushed back to December. So before I had this emergency surgery, I had an issue now because the endometriosis spread from my pelvis to my diaphragm area and around my entire abdomen area. It would cause me to um, have blood enter into my stomach. I believe the lesions were bleeding in the same way that you would bleed for a period or something like that. Every time I had a period, it would bleed. So, and because the blood had no way to escape, it continued to fill my stomach, and so my stomach was like super bloated. I would probably say probably looked like 8 months pregnant at that point because it was just blown out, and they would have to drain my stomach at the hospital. And to drain my stomach, they used a needle this big. It was a very big needle. And first they would numb my stomach. Then they had to drain. They used the needle to drain it. And the bags they used to collect the fluid was about this big. So it was a lot of blood that they were draining. And they wanted to test the blood as well. And it turned out that it was all endometriosis related. Usually when people have like a lot of fluid in their stomach, it's usually cancerous. They call it ascites, but this ascites was caused and that I think that fluid is usually clear, but this ascites was caused by the endometriosis, and it was bloody. It was like brown blood, which is like old blood. So yeah, I basically had to do this specific procedure every 4 to 5 months because my stomach would fill up so fast with blood. Um, so after this happened, quickly afterwards, um, I started my symptoms got worse, and I was in so much pain. It was every month. Before it was on my period, but at this point it started to be during the time I would ovulate. On my period, it was becoming more frequent, and so I was I found myself in the hospital very very frequently. So the third surgery um, ended up being an emergency surgery. I really didn't want the surgery because I knew I had the main surgery I wanted to come up. It was coming up in August. So that was like my biggest concern because I knew that this surgery was coming up. But because they thought that something was affecting my bowels or something like that, they thought I had some sort of issue with my bowels or something
Bowel
like that,
obstruction.
a bowel obstruction. Um, they decided that they needed to perform emergency surgery. So when they um, performed the emergency surgery, it turned out that I don't even think they saw the bowel obstruction. Whatever it is they thought they saw, they didn't really see it. And they didn't do much. So then I ended up just having laparoscopic surgery. I don't want to say it for nothing, but it did feel like it was for nothing because it ended up pushing back the main surgery, and they didn't really do anything corrective. They didn't really take out anything much. They didn't do anything.
I just want to interject here for a minute just to kind of explain what was going on in terms of the blood settling in Shanita's stomach. What was happening is that when you have your period, you everything in your body comes with cells. So the period cells would give her the period, but then the endometriosis cells were mimicking the actual period cells. So obviously, if there's no way of escape, it's going to fill up the stomach, and that's what was really happening. As it relates now to the bowel obstruction, I put it in air quotes because it really wasn't a bowel obstruction. What was happening is that there probably was either one, two, or three endometriosis within the bowels. So what would happen is when Shanita was ovulating, those endometriosis cells, they would mimic now a bowel obstruction. So it would like cause a blockage. So maybe they used to swell or whatever and block the GI tract, the intestines, and that's why she was having like regurgitation in terms of vomiting, then nausea, and not being able to pass gas or poop. So that's just an explanation of why those things were happening within the body.
Yeah, and I'm glad my sister explained that because that's exactly what was happening in terms of symptoms. I was throwing out, I forgot to say, the second surgery with the umbilical hernia.
Umbilical hernia.
What was happening? I was throwing up a lot for both emergency surgeries I had. I was throwing up nonstop to the point where I was actually throwing up bile. Like I was throwing up what I didn't even have down in my system to throw up. And then, as Tony said, I couldn't really pass gas. I couldn't really poop, which TMI, but I couldn't do any of that stuff. And again, it was excruciating pain. There was a lot of excruciating pain. Um, and so yeah, so that's the third surgery I had, and then the last surgery I had was, I would say, was the best surgery because it was the one I was looking forward because this was with a specialist surgeon, and they removed all of my endometriosis. Um, Coming up to that time, I had a lot of ultrasounds, a lot of CT scans, a lot of MRIs just so that they could see exactly where this endometriosis was. And I also had to have a scan done with the colon doctors. I think it was a colonoscopy. I don't know. I don't think it was a colonoscopy. No, it wasn't a colonoscopy, but it was something I had to do with the colon doctors or the bowel doctors. Some, no, probably colon. But anyway, the point is, then I also, and so for that fourth surgery, I actually had three specialist doctors perform surgery on me. One was my gynecologist, slash endometriosis specialist doctor. The other one was a colon doctor who dealt with the rectum area. And then the other one was a urologist, I believe. So, and they did a fantastic job in removing the endometriosis. And yeah, so I had four surgeries altogether.
Okay, so what was recovery like?
So recovery, I would say for the first, I won't even talk about recovery for the first procedure because that was like nothing. Like I didn't really have a recovery for that because it wasn't anything ready to recover from. It was quick and the second and third procedure, I mean second and third surgery, I would say recovery probably lasted about 5 to 6 days. Half of that I was in the hospital. I probably spent 2 to 3 days in the hospital or something like that, and then after that I spent a couple of days home. But it wasn't a long process for me. I got back on my feet pretty fast. The last surgery was the one with the most recovery, and what I would say about that recovery, first of all, that was around December. December 7th was the day of my surgery, and I ended up spending 6 days in the hospital after that. I had tubes coming out of me like I don't know what, like a cartoon character. Um, and then I had these things on my legs as well because I wasn't mobile much. I had to have my, what do you call it? Like, I had to make sure my blood was being
Transported well.
yeah,
So it was like
regulated.
so what it was is that they had to like try to keep the had to keep her legs getting mobilization through those parts, and that's why they were telling her that she needs to walk around her stuff because the biggest complication from any surgery at all, whether abdominal, whether leg, whatever, you will get a clot or
Right.
get clots. Clots will form and they will travel.
Right.
So those are called embolies, and when they travel, you really don't want them to travel because they can cause a stroke. The clot could go up to the head, or it can go to the lungs, which is called a pulmonary embolism. So that's why she had those things on her legs.
Yeah, but I would say that a little correction for Tony in the beginning stages. They didn't tell me to walk because they had those things on my legs to help make sure that my blood was being circulated well and everything. Um, and as Tony said, to make sure that I wouldn't get any clots and so on and so forth. Because in the beginning stages, I couldn't move. I had just come out of a humongous surgery. My surgery actually lasted 10.5 hours. It was supposed to last 7 hours, and it ended up lasting for 10.5 hours. Um, and so I ended up in the hospital, like I said, for 6 days. When I came out of the hospital, I felt like a brand new person. I felt like I could do anything, and I felt like I could eat anything. So funny enough, I had a full breakfast the day I came out of surgery, and I felt like, oh man, there ain't nothing at all though. But the people said, that the surgery, the recovery gonna be rough and this and that. I actually had two exams as well coming up around the time of the surgery. I think one of my exams was on the 9th or something, and the other one was on the 14th of December. Regardless, I thought I would make it to my exams, and I was so confident that I was going to make it to my exams. But clearly, the joke was on me, and needless to say, it was a big no for the exams. Um, but after I felt like a brand new bird and I felt like, ooh, this is nothing or whatever, then I ended up getting a big reality check because I ended up getting so sick and was in so much pain. I believe a lot of it was gas pains though. I actually didn't experience getting any incision pain. A lot of people, when they were talking about their surgeries, talked about having pain in their around their incision sites and stuff like that. I didn't feel any pain around my incision sites, but I did have I believe it was a lot of gas pain. Um, but then I remember I was starting to get mobile, even though I was in pain. I was taking a lot of painkillers. I think it was morphine for sure was one of my painkillers or whatever. But one day I was supposed to, because I was going to the doctor's office frequently, I was getting a checkup then. And on that checkup, on the day of the checkup, um, when I got home, I got so sick and I got a really high fever and I was in pain and I just knew something wasn't right. So I called my nursey sister over here who checked my temperature, checked my blood pressure. I was like, nope, we gotta go to the hospital. So I got up and my mom was there as well. I got up to put on my clothes and stuff to go to the hospital and I felt like I was about to fall down. I was so faint. Needless to say, that was on the 21st, I think. And when we got to the hospital, it turned out that I had a really bad infection due to blood clots. So I had to end up going back inside the hospital for another 6 days. So I ended up missing my sister's birthday. When I say missing, I mean like I ended up spending my sister's birthday in the hospital.
In the ER.
And then I ended up spending Christmas Day in the hospital as well. And it was not very it's not a great thing to spend Christmas Day in the hospital, but I had my family with me, so I looked at it more of the positive. I mean, when you have dire situations like that, you can either choose to look at it from a positive standpoint or negative. It makes no sense looking at it in a negative way because it is what it is. So I kind of just went with it and tried to make it as much as I could make it. I ended up coming out of the hospital on the 26th, which would be like today, because today is the 26th.
Today is
oh, no, my bad. I gotta be dreaming. Anyway, today is the 27th, because Friday was the 26th.
Yes.
But it's 12 o'clock. Okay, yeah. Anyway, well, it would have been like yesterday, technically, 2 years ago. So, yeah, so, when I came out the hospital, this from the second time, um, recovery was again pretty challenging. I barely was eating, and I had to force myself to walk. My parents really pushed me to walk, and I was also getting sick consistently with the cold or the flu. I believe it was like the flu. I was getting, because my immune system was very, very low, I ended up getting really sick. And so it was a challenge, but I made it. Within a couple of months, I would say within about 3-4 months, I was fine, pretty much. So it was a challenge, but it was something that had to be done, and I am very grateful that I got through it. I would say I am also very grateful for my doctor, because usually here in Canada we don't get hospital rooms covered, and for my first stay, he made sure that what I would say is that if you're sharing a hospital room with 4 persons or 3 other persons, then it's free. But if you have to share with one person or you have a hospital room for yourself, you have to pay for it. So I ended up having to share a hospital room with one more person, which I would have had to pay for, but he covered that for me. I'm not sure if it's like it was a grant or something that's given through the hospital. I don't know. But the point is, I did not end up having to pay for sharing with one person. So I'm also grateful for that. The second time around, I ended up just going into the regular 4 people room. And so that's what my recovery was like. It was challenging, but in the end, it worked out and it was worth it.
Okay. So, what was your scariest moment with your endo journey?
So I would say my scariest moment would be the time that I had the third. Actually, it wasn't even the time I had the third emergency surgery, but it was a little after. It was like a month or two after I had that third emergency surgery. And again, I had the issue again where I was in excruciating pain. I couldn't pass gas. I couldn't, the whole 9 yards. And I went to the hospital um, again. It wasn't the same hospital either that I got the first surgery, the second surgery. Then it was the main hospital where I would have been getting my last surgery. Then, so the second surgery was done in another hospital. This third and fourth surgery was done in the same hospital. So, I have that right? I think I have that right. Anywho, after the third surgery, about 2 months or so afterwards, I went back to the hospital because I was in excruciating pain and they wanted to give me another surgery. And I said, hell no, it's not gonna happen. So they put me on drips and stuff and trying to convince me to have that other surgery. And I was adamant that I was not having it because the first time my main surgery got pushed back, like I said, to December, and it was not, and I was adamant that I was not going to get pushed back again. So, because my doctor had told me um, that I need to recover for 6 months before I have the main surgery. So, since I had the other surgery early up, I had to end up getting it in December, the main one in December. So, I think in October or something, they wanted to give me another surgery, and I said, absolutely not. And they put me on drips and stuff, and then my mom was in the hospital room with me at that time, and I would not lie, about 8 doctors came in. First, it was one doctor who tried to convince me to get this surgery done. He mentioned something about a feeding tube and something else, and I was like, absolutely not. Then after that, about 5 more doctors came in, and they tried to be like, oh, you need a surgery, it's important, da 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 da. And they said all types of stuff trying to get me to get this surgery, and I said, absolutely not. I was very adamant about my answer. Um, After they had their little consult and conversation about how they were going to try to convince me, they left. Um, and then another doctor came in, and this was a female doctor, and I would never forget the words she said to me about, oh, if you don't have, she said all types of stuff trying to convince me to get this surgery, but the last thing she said was, if you don't get this surgery, you could possibly die. And I remember telling her very clearly, that's the risk I'm willing to take. And after she was done with all her hullabaloo, she exited right where the door was. And my mom, I remember my mom said, Shanita, let me pray. Like, we have to pray out all of this negative energy over here. We have to pray for, whatever it is that, it was just a dreary moment. And my mom prayed about the whole situation. She prayed over me. She prayed for everything that was going on. And then after she was finished praying, they sent one more doctor in to try to convince me. But in my opinion, this last doctor that came in didn't really try to convince me so much. She was more so like solution oriented, where he was more so asking about what do I want to do. And I think that that was a very big important moment, because that's what they should have done in the beginning stages. They should have recognized that as the patient, I have a choice in my medical where I want my medical situation to go, and they should have just asked me, what would you like to do, instead of trying to convince me. Because when they asked me the first time and the second time and all the other times, my answer was very clear. It was going to be a no. So he ended up saying, okay, so this is what you can do until it's time for your main surgery. And he was very friendly. He made conversations. He made us laugh. He made the dire situation a lighter situation. And we left feeling much better after having a conversation with him. But for me, that was the scariest moment, because having all of those doctors come in with such negativity. I don't want to say it's negativity, but they were making it sound like it was a life or death situation. If I didn't get this surgery right now, what would have happened and what wouldn't have happened? And having to stand up for myself in that moment made me realize that I am stronger regardless, and I am also, despite their expertise, despite whatever, I knew what I wanted and I stuck to my guns on what I wanted. And I think that's a very important moment for a lot of people as well, to represent yourself. Regardless of the pressure you're feeling, represent yourself, especially if you know what's best for you. Um, right, so in the end, I went home feeling later because I knew I was going to get the main surgery that I wanted, which would have removed all of the endometriosis of my body.
Okay, guys, so we're going to have to do a part three. Um, so we will look forward to that one, a part three, cause Shanita's journey is very long. It was a long journey, and I know there's a lot to say. A lot still needs to be said. I hope that's good English. And we are going to have to break here, and we're going to be doing part three for you in a little while. So please like,
Share,
and subscribe. Until next time, bye.
bye.